Welcome to Facts TV News, where everything is true. Man charged with murder after intervening in couple's dispute. 37-year-old Damian Dixon, otherwise called Twitch, was yesterday charged with the 2016 murder of a man after he intervened during a couple's domestic dispute in Bull Bay, St. Andrew. Dead is 45-year-old Brenton Lawrence of the community. According to the police, on May 12, 2016, about 9:30 p.m., Lawrence and the woman had a dispute when Dixon intervened and used a stick to stab Lawrence in the throat. Lawrence was taken to hospital where he was pronounced dead. Robber shot, gun seized during Manchester hold-up. A robber was shot and a Taurus 9mm pistol with a magazine containing 11 9mm rounds of ammunition handed over to the police following a reportedly hold-up in Lincoln District, Mandeville, Manchester on Monday, February 22nd. Reports from the Mandeville police are that about 9:15 p.m., a man was in his yard when he was approached by a man armed with a firearm who proceeded to rob him of cash amounting to $100,000. Police reports are that a licensed firearm holder who was in close proximity intervened and allegedly shot the would-be robber who ran leaving the illegal weapon. The police were alerted and the illegal firearm and ammunition handed over to them. The complainant escaped unhurt. Investigations continue. Call ahead of time, UHWI urges as it grapples with COVID-19 cases. The University Hospital of the West Indies, UHWI, has advised the public, private medical practitioners, and hospitals referring patients to make contact ahead of time before transfers as it continues to grapple with a spike in COVID-19 cases. Last week, the Papine St. Andrew Base Hospital was said to be at capacity. The hospital made the plea for contact to be made ahead of arrival, pointing out in a statement on Monday evening that it has limited bed space. With the ongoing surge in positive COVID-19 cases threatening to overwhelm the country's health system, the Minister of Health and Wellness, Dr. Christopher Tufton, was forced to reassure the public on Monday that no one will be turned away if they show up at a hospital. But, in a series of tweets, Tufton suggested that persons can expect greater waiting time at hospitals as staffs are stretched. The developments come amid a spike in COVID-19 cases over the past 2 weeks, resulting in higher numbers of hospitalization of positive COVID-19 patients. Statistics revealed by the Health Ministry on Monday showed that 267 persons were reported to be hospitalized up to Sunday, with 43 patients classified as being moderately ill and 18 patients listed as critically ill. In renewing his plea for Jamaicans to follow the COVID-19 protocols, Tufton tweeted that healthcare workers were overwhelmed and fatigued in the face of the present situation facing the country. The reality is that we are in unprecedented times, the hospitals are at capacity, and our healthcare workers are overwhelmed and fatigued, he stated. Jamaicans, it simply cannot be business as usual. You must follow the protocols outlined and communicated constantly by the government or risk losing your life, he stressed. Tufton advised that discussions have taken place with the relevant stakeholders to assess the situation now facing the hospitals. A total of 297 COVID-19 cases were recorded on Sunday, increasing the national tally to 21,679. Of that number, 8,083 cases are active, while 399 persons have died from the virus. Teachers to be among the first to get COVID vaccine. Teachers and other persons deemed to be essential to the operation of schools will be included as a priority group for the COVID-19 vaccination, according to the Minister of Education, Youth and Information, Favour Williams. To coordinate this important development, we began talks today, Monday, with the Ministry of Health and Wellness regarding a schedule of vaccination for this priority group against the COVID-19 virus, said Williams in a statement from the Education Ministry. According to the statement, Williams has also updated the Jamaica Teachers Association, and there will be further discussions over the next few days to look at the option and criteria for prioritization among the various personnel in the education system. Teachers were not initially named among those who will be first in line to get the COVID-19 vaccine. Among that group that was first announced last month by the Minister of Health and Wellness, Dr. Christopher Tufton, are healthcare workers, members of the Jamaica Constabulary Force, members of the Jamaica Defense Force, correctional officers, custom and immigration officers, parliamentarians, persons in infirmaries, and the elderly. Teachers in line for first job. Jamaica Teachers Association President Josford Gabriel has welcomed word from the government that teachers will now be among the priority groups to be inoculated when Jamaica receives batches of the COVID-19 vaccines. That development could rebuild confidence among parents and teachers in engaging in face-to-face classes, the absence of which has caused marked learning loss among students. Most of Jamaican schools have remained shuttered since the mid-March 2020 emergence of the coronavirus. Education Minister Favour Williams announced Monday evening that teachers and other persons essential to the operations of schools will be included in the priority category. Gabriel said that his association was satisfied, having lobbied relentlessly for teachers to be included in the list of persons to receive the vaccine first. Both teachers and students are highly exposed and ought to be considered and included in the priority list, he insisted. Gabriel said the vaccine will give teachers an additional layer of protection against getting very sick from the COVID-19 disease. The JTA president said the news will help to ease the anxiety of the teachers who have been worried over the spike in COVID-19 cases in February that has overwhelmed the public health system. Jamaica recorded 21,679 coronavirus infections as at Sunday, 8,083 of which are active. Leaders of Jamaica's 3 leading universities and a major teacher training institution pressed the government at an editorials forum to consider tutors and students as a core coherent for vaccination. We couldn't compete with the nurses and doctors and frontline workers who are faced with that every day, but I think the second string of persons should be those in education, said Dr. Ashburn Pinnock, president of the Micro University College, last Thursday. Gabriel was unable to say what percentage of the more than 20,000 JTA membership had expressed a willingness to be vaccinated. Nonetheless, he reported that he intended to take the vaccine when it becomes available. The JTA president disclosed that more than 30 schools that have resumed face-to-face operations have been forced to either pause or stop classes because of coronavirus outbreaks. But Gabriel would not be drawn on whether he would support the full reopening of schools come September. I cannot say what percentage of the population is going to be vaccinated for one, neither can I project what the spread of the virus will be. We still have to work with some kind of approach for the full reopening of school that is clear and understandable to all, Gabriel stated. Prime Minister pleased with shift in public sentiment regarding COVID-19 vaccine. Prime Minister Andrew Holness says he is pleased to see that there is now a shift in public sentiment regarding the COVID-19 vaccination, with more persons seemingly willing to be vaccinated. He said he plans to be at the head of the line to receive the vaccine once it arrives on the island and the process to administer it begins. The Prime Minister, who was speaking at the ceremony to break ground for a $16 million recreational center in Olympic Gardens on Friday, February 19, attributed the shift in public sentiment to the fact that people are seeing individuals in other countries receiving the vaccines, including their family and friends who have migrated. They have seen no adverse effect, and I think my sense now is that there will probably be a greater take-up, he noted. The Prime Minister noted that with indications being that more people may take up vaccination than had been initially anticipated, the Cabinet is going to reconsider the allocation that was made for the Public Education and Promotion Program. We still, however, have to maintain some minimum amount of public education because, as you can imagine, the logistical effort involved in deploying the vaccine will still require the government to communicate with the citizens the time and place and availability of the vaccine and explain to citizens what the vaccines will do and what side effects there could be, if any. So, there still has to be some budget for that, but I believe in our reconsideration that we could reallocate those resources to other areas in health, in fact, to even acquire more vaccines, he said. The Prime Minister said that the government has ensured that the vaccine will be provided to Jamaicans is safe. We were very careful to ensure that any vaccine that we are bringing to the country has World Health Organization (WHO) approval because ultimately we want every Jamaican to feel safe taking the vaccine, Mr. Holness said. Commonwealth SG urges equitable access to COVID vaccines. Poorer countries will most likely bear the brunt of hundreds of thousands of needless deaths for inequalities in access to COVID-19 vaccines. This dire warning was given by the Commonwealth Secretary General Patricia Scotland in a video address to the high-level segment at the 46th session of the UN Human Rights Council in Geneva today. More than 130 high-level dignitaries, including heads of state, foreign ministers, and heads of international organizations, spoke during the high-level segment. The Commonwealth Secretary General said, COVID-19 has shone a harsh light on health inequalities within and between countries. Nowhere is this more evident than in access to vaccines. Although vaccines are a vital lifeline, they remain out of grasp of far too many. Crucially, it means that citizens of the poorest nations may bear the brunt of hundreds of thousands of needless deaths. We must not allow this. Leaders of our world must come together to ensure that this does not happen, Scotland said. She also warned inequitable vaccine access could derail the global economy recovery and make wealthier nations lose money. COVID has taught us that in order for any of us to be safe, we all must be safe. We must act together, she added. This past year has enhanced lingering existential threats, including the climate emergency, the Secretary General stated. She reaffirmed the Commonwealth's resolve to support small states and other vulnerable countries to protect the environment and tackle climate change. The Commonwealth's 54 member countries include 32 small states. Social injustices, including discrimination, poverty among marginalized communities, and violence against women and girls were also highlighted during the session as exacerbated by the pandemic. Scotland called for inclusive development and multilateral cooperation, stressing that recommitment to human rights must be central to COVID-19 recovery efforts. Human rights are not the panacea to all challenges brought about by the pandemic, by climate change, or by the never-ending list of conflicts across the world. But the last 12 months have taught a painful lesson to humanity. We must learn from experience. We have to make human rights central to building back together. Without human rights, humanity is not a sustainable project. We cannot afford to fail, Scotland said. Please remember to subscribe, like, share, and click the notification bell for daily updates.